My role was working with a second-year resident who had been directed with me to go to the emergency room. We were up on the second floor surgery clinic that day, and we had patients that had come in during the night from for various complaints, and the chief surgery resident directed us to go to the emergency room to take care of them and see which ones needed to be admitted. At that point, we had gone down, and the way the hospital emergency room was laid out at that time, there were cubicles with curtains in front, and sections of the emergency room were for surgery patients, internal medicine patients, obstetrics, gynecology, and pediatrics. And there were two operating rooms that were downstairs that were more major surgical procedures could be performed for resuscitation before taking them into the hospital. And we were in front of one of those when we heard the announcement from the triage desk that they needed stretchers. And there was just a lot of banging noise, which was unusual. I mean, you just wouldn't hear that. They were hollering and screaming through the intercom. And so at that point, Dr. Red Duke was the chief resident running the emergency room. He was in charge and immediately started going to that first operating room, which was operating room 2, actually. There he, as we came out of our cubicle, they were rolling in a gentleman who's gray hair and wearing a silver gray suit, alligator boots, and striped tie, and I thought, what are they doing here at the emergency room at Parkland County Hospital? And it was Governor Connolly, so we went into that room to assist Red Duke in the initiation of the resuscitation. At that point, we undressed him to see where his injuries were. He had a gaping wound in his chest. We put I put some gauze across the wound in order to seal it so that he could reconstitute, perhaps with a chest tube, the lung on that side. Dr. James Carrico, he's a second-year surgery resident, said, let's go and get ready for the next patient. So as we walked out of that operating room, they were wheeling in President Kennedy, and you know, it's just disbelief when I first saw it. I thought, that wasn't President Kennedy. They probably had doubles that they put in the car and run around and show. And there was a funny movie about that some years ago about a duplicate. So immediately this part is just embedded in my brain. Is just this part of his head was blown away and the brains were exposed. The calvarium had slipped behind his head and was still connected by the scalp and the base. And so we wheeled him in and started to get the IV started. Carrico went to do intratracheal intubation, and I can still hear him say, you know, boy, did I luck out. I just got that tube past a severance of the trachea and to breathe for him. At that point, and Jackie Kennedy had come by along, and she was walking behind the gurney. Her dress was all matted with blood and clots and brain tissue dropping from the skirt, and she was standing outside. The doors were closed, and at that point the Secret Service men came in, and they were cursing and just in their anxiety and their stress of the day, then said, wanted to know who was in the room with them. And I'd taken off my white jacket because it was clean that day, and I just got it from the cleaners, and I didn't want to get any blood, which sometimes happened for our patients. We were resuscitating. And so I had a tie on, and they said, "Who are you?" And I said, "I'm a senior medical student, Schorlemer." And so they said, "Well, get the hell out." And so I was starting the IV, and which was kind of odd because you want to get the resuscitation going while there's still blood pressure enough to insert a needle. So I left and immediately went to the phone at that point to call the neurosurgery chief of staff, who was Dr. Kim Clark, and Dr. Charlie Baxter, who was the acting chief of surgery for the Department of Surgery for the medical school. And I put in a page for them to come down immediately that the president had been shot. At that point, I called my brother, who was a twin brother, who was working in the blood bank at the time, and I told him to bring 2 units of O-negative blood that we suspected we might need, and had been directed by Dr. Carrico, and then I gave it back to them. They weren't allowing anybody else in there, so there was all these people that were in the hall of the going to the emergency room, trying to look in through a little glass window, and there was just a lot of things going on inside and out of the excitement of that tragedy. When I reflect on it, there was no one assisting Jackie at that point. She was just standing outside the door in shock. She wasn't crying or anything. She just had a distant look on her face. One of the medical students walked behind the area there because it was blocked off, and came in through the back and started talking to her. So he was consoling her, and that was the only person who was around her. It was odd that there weren't Secret Service surrounding her or assisting her. At that point, then, about 30 minutes later, a priest came in, and then I guess around 1 o'clock or 1:15, they pronounced that he was dead. When he came in, he had some agonal respiratory movement when he was just being wheeled into the room. But that injury was so severe because of how that impact and what it does to the brain that I'm sure it affected the breathing centers in the brain for him to continue to be able to breathe even after that point. It was mind-numbing. I mean, there wasn't things that you could concentrate on from that point forward that day. No one tried to make diagnostic decisions about whether that person could stay or not. So after James Carrico got through, we just went through the whole gamut of all those patients and admitted them until we could have some other staff looking in on them and making a decision whether they needed to have surgery. But that carried through for the whole week. The issues of what transpired, because it was a day and a time of the fears of what was going to happen in the government and the way the government was going. Dallas was considered a bed of conservatism that was significant. And so the disappointment of what happened really affected everybody, including people who were from Dallas to begin with. So there was so much sadness, but also sadness from the tragedy that had happened in Texas, or happened in Dallas itself, because no one, I think, really wanted that sort of thing to be a mark on them, but also to have even happened. Other things that went on for me in that time was that it was an oddity. The next day I had to go and I was directed to do an EKG. At that point, all medical students did what we call scut work. It was the work of diagnosis, drawing bloods, and doing EKGs. We were the technicians doing an electrocardiogram, and I did an electrocardiogram when I was on call that next day on Governor Connolly, and the oddity there was we didn't have a SICU. He remained in the recovery room from the surgery after surgery, and you walked in. It was kind of a dark area, and it was a little off of where all the recovery room patients were, but not that far. There weren't a lot of Secret Service people around or anyone watching over him. I mean, I could have been anybody walking in to do that EKG. Obviously, I think that's changed for people in terms of the injuries that would have happened. It probably would have had more people around, but I guess there was still trust, and Governor Connolly was, I'm sure there was somebody there, we just didn't see him in the forefront. I had a roommate, Dr. Fred Bieberdorf, who was a senior medical student with me at the time, and he happened to be the jail doctor. So the next morning he was on site when Lee Harvey Oswald was being transferred from the city jail, and had to then ride in the ambulance to Parkland Hospital with him. And he didn't get anything out of Lee Harvey. He was in and out. I think they thought that he was dead already because he was hemorrhaging from a shot through the pancreas. I mean, through the spleen and the liver both. They got him to the operating room though, and he was still alive. And he died because he had cardiac arrest there. And at that time, they thought that maybe because they were massively transfusing him with cold blood, that they couldn't revive the heart and make it start up again. Otherwise, maybe he might have lived. And nowadays we know, and there are blood warmers for patients who have to receive massive blood transfusions. But it wasn't something of my making, it was just something to be there. And so I never thought of it as anything other than I was a witness to a very significant part of history, that there was personal, touching, and a mere chance of resuscitation that really wasn't.
Is it something that you don't like to talk about?
Well, it's a short piece of history. It's not something I did per se. So there were more important figures in this whole sphere of this story. The doctors that at least were there, who were higher up on the echelon of trained physicians, the department heads. So as a senior medical student, you're kind of looked, I guess at that point, senior medical students are a non-entity, so to speak. When Dr. Kirko gave his testimony to the Warren Commission, he gave a list of people who were there. He didn't give my list, but he and I were kind of like a team. You follow a resident around, and so one of the things was, well, you don't need to be taking away from your time on your education or where you are. You hear of things later that went on, perhaps in terms of those other instances. I started to talk about Dr. Bieberdorf, and you get together sometimes on reunions and you hash over things, but there wasn't any documentation that I was there per se, just as there weren't of a lot of other students that were perhaps in that area, maybe not even the person who was speaking to Jackie. It's the work of the day as far as what we were doing. I mean, that's what you're trained, that's what you go in for. And then you go on to the next patient and may do the same thing. I guess you look to your professors, and they're the important people. The residents who are training with you and helping you to learn are those important entities. And I didn't feel myself as being the lifesaver. And so if you weren't that part of saving a life, it's just a memory that you have, and you discuss that with your friends sometimes. And as I remember November the 22nd, I'll just casually ask nurses or someone, what happened this day, and a lot of people weren't remembering that day. They don't put that day into context of such a momentous occasion of tragedy. I think as we grow older, memories begin to be more and more important. There may be some emotion about it. It's still easy to disbelieve, that happened. It just, that was just something that in today's world or in that day's world, you wouldn't suspect. I think there have been so many terrorist events nowadays that almost, I think, the public is becoming used to it to a point that it doesn't make the same emotion that it used to. Back then, there were days and weeks that we couldn't stop talking about it. In those days, you didn't have cell phones. You didn't have everything that we have now to communicate more rapidly and bring in those people. If the speed at which they came from Dealey Plaza to down Harry Hines was quite rapid. So there may have been there have been some remarks about being notified a couple of minutes beforehand, but I think those minutes were from the front desk from the time that they arrived at the front of the emergency room till they arrived in the suite itself. So there wasn't, we didn't have any way of communicating. I suppose maybe the radio of the police car coming and saying, "We're bringing in wounded." There are people who are paranoid. There are people, just as the person who shot him, having a pathological vision of life or of who's the enemy. And there are opportunists as well. People who write books want to sell books, and those the more weird they can get in terms of information, I think, and building up little side stories will be able to do that. And as far as that's concerned, that's beyond my expertise in terms of that dealing of how many bullets could be fired from a gun. Most recently, there was something in the Wall Street Journal about how the bullet was tumbling and therefore was able to show how it created its injury both to two people at one time instead of 3 bullets. So someone was mentioning this morning about, well, since Jack Kennedy had his back brace, it kept him from falling forward, and therefore it put him in danger of having his head hit on the second time. Those are into the people who do physics, who know the abilities of a shooter to be able to accomplish that. So was there somebody on the grassy knoll? I guess you have to just read the books and listen to the experts. There's so much to be doing as a senior medical student, to be learning. it's beyond the pale to even think of what you need to know in the books and what you are able to know. And so those were your goals, and in that immediate time frame, you're reading what you get in the newspaper or hear on the radio. To become the expert over time was something that I just didn't have time. As I said, we moved around, and so there were all these other issues that were part of the more important picture. You knew what you knew, and I left that up to others to try to decide.
Because that's something on big anniversaries. Everyone asks where you were.
Oh, everybody can say. Everyone who's alive at that time and remembering. I mean, and that's what you find out once you start talking about November the 22nd. Oh yeah, I remember that. I mean, I was here, and tears were always a part of that for almost everyone who remembered.
I got to imagine at dinner parties when people start talking about where they were when Kennedy was shot, you got the trump card, like you got the ace in the hole on that,
Yeah. That stops the conversation if someone brings it up, and I'm sure that's going to happen the next week or so. I mean, it's already happened.
What do the people in the office when they find out? What do they say, or what is the reaction when they learn this about you? And some of them have known you for years,
and yes, and say, why didn't you tell me that?
What do you tell them?
Yeah.
Is it something that you just don't make a big deal about?
I don't make a big deal about it. It's just, well, you tell a story and you then assume everybody else knows, and somebody else comes into your life or passes through, and then you have to tell a story again. So it's, I guess, a little repetitive, but it's also, it's not, it's not an accomplishment. I mean, delivering quadruplets was a exciting thing for me, and it was accomplishment of healthy children, and those are things that are something that I participated in and was successful with, and hopefully will continue to be.
I mean, obviously, someone had to be the first person to take care of him when he came in the door.
Yeah.
I'm amazed that it was
a senior student. Well, it's who's there. It's who's there, and I was at Southwestern, University of Texas Southwestern Medical School. Senior students played a big role, and we always looked, and I don't know if you want to publish this at all, but we always made a comment about the senior students were better at handling clinical aspects of care than the interns coming from the East Coast schools when they came in to do an internship, because there was a lot more practical work that we did. I mean, we were allowed to participate in that, and so there was a growing up of being a physician, I think. We didn't know everything, but there was good supervision, and I felt I had a great education when I went off to be an intern or resident.